Thank you, Katie. Next, we have Doug Brown with Nick Latulippe. Pandemic Federalism, Assessing Responses in 3 Federations.
So I can speak through this mic here? Yeah, okay. I'm just going to have a few remarks to introduce the frame of the study that we did, and Nick is going to take you through the results. My decision to research the COVID response in Canada, Australia, and the United States as federations is part of a larger book project that I've been kind of working on in slow motion for 10 years. But looking at judging the 3 systems, and I suppose wider, in a wider sense, the world of federalism more generally, to the ability of federations to achieve federation-wide coordination in areas where neither order of government can fully act alone. And so if you can bring up the slides there for a second. Yeah, and I'll let, and the second slide. Yeah, and this is essentially the outcome, of the dependent variable, which is is the government's responses, or the way the system as a whole is able to respond to some of these big picture results on COVID. There are a number of independent variables. One of them would be established networks of multi-level governance, particularly in public health, that range from the World Health Organization right down to local public health authorities. Secondly, political geography that is unique to each federation, and that is an important factor we felt in shaping and structuring responses. So the actual territorial configuration of states and provinces and so forth. Where are the large states, where are the small ones, etc. Political culture, particularly convergence or diverging trends about how the public, what kind of values the public brings, and how that affects their behavior in the COVID. And so we're seeing some major patterns there, but that's something that's a bit more common, greater to a lesser or greater degree across the federations. And then finally, and a little bit distinction to the multi-level governance concept, is the fact of borders and jurisdictions. And there's no question that in the pandemic, everybody who lives in a federal country has a renewed consciousness of exactly where the borders lie. And it's because in the absence of major centralized policymaking, which has not in fact occurred in all 3 federations, each state and province will and has, of course, gone their own way. And they have been the decision makers in a large part of this, although not entirely so. But I'm going to leave the details now, and to take you through to my very able colleague here, Nick Latulippe.
All right. Can you guys hear me through this? I'll just talk through this. It's all good. So the implied federation-wide policy objectives. So this is pretty much what every single federation was kind of using to respond to the COVID-19 pandemic. We obviously have our 5 factors of slowing the spread, if not stopping it, to find and implement effective treatment and a cure for the virus. There is somewhat of an international response, but most of the time it is fairly national. At the end of the day, everything is a unique and introspective response for every single country. So being that it is kind of an international pandemic, it is extremely decentralized in that sense. Now, third, to balance economic and social costs with pandemic restrictions, to manage the ongoing and fiscal resources to achieve the above goals, and obviously to plan and lead the broader economic recovery. So we have 2 key factors that affected the spread. The first being mobility and the second being density. Mobility obviously is within the individuals infected within a certain amount of borders. And in addition to that, we have the density. People with countries and places with high degrees of mobility are obviously more vulnerable just because of their density as well, in terms of their mobility as well. So densely populated areas such as cities, poor neighborhoods, and other vulnerable subpopulations were much more at risk. This is obviously in addition to having such a dense and mobile environment, but having less guidelines in terms of monitoring, testing, vaccination, and education, as well as information funneling. So how these two key factors, namely density and mobility, affected our three federations. So within Canada, we found that the Northern Territories and the Atlantic provinces actually had huge advantages in terms of geographic isolation. Okay. In addition to that, they also have less dense populations. So being that they have these two advantages, we found that they were able to concentrate their COVID-19 responses, and that led them to more effective results in kind of preventing the spread. Larger metropolitan areas were obviously hit harder. This is obviously places like Toronto, Ottawa specifically, Vancouver, and Calgary. Territories and Atlantic provinces pursued the zero-case strategy, which means that it was within reason to actually pursue 0 cases within the provinces and within the territories themselves. Whereas other provinces rather didn't pursue the 0-case strategy, but just tried to limit the amount of COVID cases actually active, decrease the amount of ICUs and the amount of hospitalizations. So they weren't pursuing the 0-case strategy. In the terms of the US, 0 states actually pursued the 0-case strategy, okay? Every single state actually were trying at least to mitigate as much as they could. It was, for the United States, as we'll see, it's an extremely decentralized response. Most of these cities in the northeastern cities, such as New York and New Jersey, were the first to get hit within the pandemic, and this is a huge factor in terms of density and mobility. With Australia, the outbreak has been most severe in Melbourne, but this isn't exactly a bad thing. It's concentrated, and this has actually made Australia's response one of the most effective. So they've placed travel and border restrictions in places like Western Australia and focused their restrictions in addition to that in the larger metropolitan areas, which allowed them to concentrate and respond to COVID within their certain environments. All states and territories, excluding Victoria and New South Wales, were actually able to pursue the 0-case strategy and are continuing to do so. So, current intergovernmental challenges in the pandemic. We've truly discovered that public health is very multi-level. One of the most complex intergovernmental organizations that we've seen so far in response to this pandemic has been public health. Specifically with coordination and policy with administrative systems, in addition to monitoring, testing, vaccine procurement and distribution, as well as the enforcement of COVID-19 policies, has all fallen under the realm of public health. In all 3 of our federations, the federal governments have allowed state or provincial emergency laws to do the heavy lifting. So the federal governments have actually taken a huge step back in all 3 of our federations and have allowed each of our province, territories, and states to do most of the heavy lifting and take the reins in terms of COVID-19 response. All federal governments, though, do play a major role in fiscal and material economical support. So I'm just going to go through this guy. So comparing our intergovernmental processes. So Canada employs executive federalism with loose results, meaning Canada's federal response has been much more behind the scenes than all of their governments in terms of provincial and territorial responses. The federal government had much of a less direct approach, as previously mentioned, and levels of government all had similar methods of public communication, but had consistently confusing messages over time. As we saw within the beginning of the pandemic, I guess public messaging occurred very much so within the first wave. It was consistent. Everyone was aware of the information funneling that was going on. As the pandemic progressed, we saw that less and less. For the federal government of Canada, they took care of 3 main things. The first being the distribution and procurement of vaccines. The second being the COVID-19 Response Act specifically for Canada, which assists the public with fiscal responsibilities in terms of, I guess, like things like CERB, in addition to small business loans, as well as bailouts for industry. For Australia, the national cabinet facilitated tighter coordination. So Australia's federal government did actually kind of coordinate this in terms of daily briefings with each and every state and territory within Australia. Now, what this did is that it gave each state and territory the ability to discuss how to respond to COVID-19 appropriately when each and every state had a different case. This has actually made Australia's response an extremely strong, it gave an extremely strong response in addition to very strong intergovernmental consensus. State and territories took the main lead roles and responsibilities, but having all of these states and territories working together with a daily national cabinet actually gave them the ability to assign tasks to federal agencies much more quickly and effectively compared to Canada and the US. With the US, they actually abandoned their role with the National Response Framework. So this framework was particularly created to funnel information, provide education to citizens, give states a little bit of guidance in how to respond to the pandemic. And abandoning this actually costed them quite a significant amount in terms of being able to effectively respond to COVID-19 in the United States. We saw an extremely decentralized response. This pattern of decentralization went all the way down to local governments creating their own policies and legislations in terms of COVID-19. This is not something we saw in Canada or Australia. One thing that is extremely notable with the United States, though, is their acclaim for vaccine development and procurement. Without the United States, the R&D behind the vaccinations in general would have been pretty difficult to achieve. So comparing diverse outcomes among states, provinces, and territories. So as previously mentioned, Canada did operate with the zero case strategy, but this was mostly effective and prevalent in both the Atlantic provinces as well as the territories. 3 provinces came out with higher national per capita cases and deaths, and that'd be Alberta, Quebec, and Manitoba. Specifically for Quebec, we found that within the first wave, there was high concentrations within long-term care facilities, which led to a high number of deaths. In addition to that, Quebec also has very high levels of public disobedience to public authority, which doesn't assist in terms of COVID regulations as well. The same can be said about Alberta, not in terms of the long-term care facilities, but mostly about the public authority aspect. Specifically with Alberta as well, they also relied on voluntary restrictions. And being that they were relying on voluntary restrictions and not having them mandated, it led to less public obedience in terms of that. Furthermore, with Alberta, they also relied on, not exactly relied on it, but they were extremely hesitant. And hesitancy costed them higher COVID cases as well. In the case of Manitoba, we actually saw a high concentration of COVID-19 cases in poorer neighborhoods and cities, specifically within Winnipeg. This was mostly focused within the Indigenous communities, specifically because it is a dense area, in addition to having high mobility around the city. And Manitoba's cases also led to higher disobedience in terms of response. In the case of Australia, their 3rd wave is currently our 4th wave. So they have the huge advantage of geographic isolation, which is why this is the case for that. Specifically right now with Australia is that all of their cases, if not like all of them, are focused within New South Wales and Victoria. Now, this isn't a bad thing. This has actually made their response extremely effective because they're able to attribute all of their resources within these specific areas, in addition to how they respond to it. And now we're with the US, it's still a world leader in terms of COVID-19 deaths and cases. Cases were found to centralize between urban, poor, and minority environments of the United States, which is an extremely strong correlation that we found when we originally started writing the paper and came in conclusion with our results in October of last year. More so, we found that states that implemented stricter regulations and guidelines in terms of COVID-19 were actually associated with blue states, namely Democratic. And states with Republican, leaders were actually found to have higher COVID cases because of their less restrictive regimes. So as I previously said, because we came to a conclusion with our research as October of last year, this was kind of a groundbreaking result that we kind of found. And then obviously, states, so having that high correlation was pretty prevalent to see in the data. And that was a really cool find. conclusions in terms of our presentation. So federations exist specific patterns of divided and shared legal authority with administrative responsibility depending on the policy field. One of the most prevalent examples with this would obviously be the public health system. It's a complex intergovernmental organization, but it's completely multi-level and it requires much coordination in terms of their policy and administrative responsibility. In all three of our federations, the federal government has exercised fiscal support and capacity associated with pandemic emergency. Again, previously mentioned with the COVID-19 Response Act, the Quarantine Act, which specifically allows them to create borders and travel restrictions in Canada, in addition to procurement, distribution of vaccines, in addition to fiscal resources attributed to individuals throughout the country. The federal government could not order states and provinces what to do in terms of imposing an emergency state. So, as previously mentioned again, the provinces and territories, each and every single one of them took the reins in terms of responding to COVID-19 in policy and both legislation. Decentralization has been mostly an asset and not a liability. This is especially true for Canada and Australia, but less so for the United States, specifically because their decentralization almost trickled down to local governments, which caused a ton of chaos and confusion in terms of response. Geographic isolation is a huge advantage. This is especially true for places like Western Australia and Canada's Atlantic provinces. Political culture concerning values, beliefs, and behaviors about the pandemic unquestionably play a key role. This is obviously tied to specifics in terms of contention with political divide. This has been I think everyone can understand, it's been most exemplary in the United States. This still does occur in Canada and Australia, but is less so prevalent. Anyways, that's it. Thank you.